Next up, with our Pqi Clinical Overview is Natasha Heimbigner. Natasha will speak about the Pqi that she wrote on managing immunotherapy treatment-related rash. Natasha.
All right, so my in-office dispensary is located inside of a clinic that also provides IV therapy to our patients. So because of that, I get questions relating to IV side effects on a daily basis. So that motivated me to write this Pqi in regards to immunotherapy and rashes that are related with treatment. The most common adverse effects are dermatologic toxicities, GI, hepatic, and endocrine toxicities. But in this Pqi, I focused on rash since that's what we tend to see most with immunotherapy side effects. So since immunotherapy is becoming more and more common, as you guys all know, immunotherapies cover multiple different types of cancers. Listed here: melanoma, non-small cell lung cancer, breast. I mean, the list just goes on and on and on. So the more common that immunotherapy becomes, the more we have to deal with these side effects. And the most common rash that we tend to see is a maculopapular rash or a pruritic type rash. Of course, there's other types, not limited to these here. So definitely other things to look out for, but we're going to be focusing on this today. Next slide, please. So in the Pqi process, the first thing that you want to do is to identify which patients would be affected with this. With immunotherapy, all patients are at risk for having these rashes. Next slide. So we would want to determine the grading of the rash, first of all. So with a grade 1, it covers less than 10% of the body and is pretty mild or localized. With a grade 2, it would be 10 to 30% of the body surface area. This would be more intense, more widespread. And then grade 3 and 4 would cover more than 30%, would limit daily activities, be pretty severe and or life-threatening. So of course, you know, a lot of times you would consult with the provider, but this will be a good guideline for us to start things off. Next slide. So what we recommend with a grade 1, again, that's less than 10% of the body surface area, is starting with an emollient cream. So there's tons of these out there. Here's just a couple of examples with the lanolin oil or the emu oil. And then possibly the use of a steroid cream. In our clinic, we are partial to triamcinolone cream, but you could also use hydrocortisone as well. With a grade 2, again, 10 to 30% of the body surface area, this is when you would consider holding treatment until symptoms have started to resolve to a grade 1 or less. You could also consider using a topical antibiotic. Something that came up in our practice last week that is not on the Pqi is making sure that these topical antibiotics are alcohol-free if the skin is broken at all. There's a nice list there for you of the different options that you have for the topical antibiotics. And if it is more on the severe end, you could consider taking an oral antibiotic as well. Next slide. Grade 3, this is going to be greater than 30%, but not life-threatening. Again, you would want to interrupt therapy and consider discontinuation if the rash does not improve. Again, topical antibiotics. And at this point, you may start to consider IV steroids, IV antihistamines, IV antibiotics. And a lot of times when our patients reach a grade 3, we do bring in a dermatologist to consult at that point, since it is getting to be a large surface area. And then with grade 4, you would definitely discontinue the treatment with the immunotherapy and consider IV treatments to help your patient out. Next slide. For patient-centered activities, you would want to provide education to the patient on their medications, IV and oral, and provide proper skincare tips and tricks. This could be anything in the spectrum of skincare, from using warm water, not hot, to making sure that the patient's skin is properly moisturized. All of those things that we know about that patients may not, to help them with their skin. Infection prevention, making sure the patient's keeping their rash clean and dry. If there's any open areas, focusing on those. And then monitoring the skin and making sure to call the provider if it worsens. A lot of times, patients seem to be more open to pharmacists and technicians than they tend to be to providers. So it's okay to ask probing questions and be straightforward with them. And so I would encourage you to do that as well. Next slide. And here are the references for you. Are there any questions?
That was fantastic, Natasha. Thank you so much. We will definitely open up the floor now for questions. As we talked about, many different ways for our participants to interact with us today, either through the chat box, Q&A box, or the raise hand function. If you do have a question for Natasha, we'd be happy to answer it now, or we can field questions at the end of today's webinar and ask during that period. So Natasha, we'll give it just a second. And before we begin the general questions, I just wanted to ask you, what are some of the main takeaways that you think are extremely important from your PQI?
Well, I think that this is a fantastic reference for physicians. At least once a week, I get asked about this, so I keep this on hand to give to my providers. But then this is also something that would be great for pharmacists and technicians, nurses as well, for things that a patient might not be asking the provider about a mild rash. So what can we educate them with? So the use in grade 1 especially, when we can teach them about emollient creams and skincare tips and tricks. I think that's a great takeaway for this PQI.
Yeah, I would agree. And I agree with you as well that as these immunotherapies become more common in practice, there really is going to be the need for, PQIs like the PQI that you've written. Now, we did have a question come in through the chat box, and the question reads, have you already implemented this PQI at your practice? And if so, can you share your firsthand experience with how it has helped improve patient care?
Yes. Before we even published this PQI, I started using my own version of it in the clinic, and it found out that I would send to providers, and it's been great. They all have the same information, all of my providers do, so they're able to treat across the board the same way. And so we've had really good success with this.
That's great to hear, Natasha. Thank you. And for now, that was the only question we had. If we do have any questions as the webinar progresses, we'll hold off till the end, and we'll ask at that time. But again, thank you so much for your work on this PQI and your presentation today.